So today we will be discussing prescription writing. Now what is a prescription? So first we will discuss the definition of prescription. So prescription is a written medico-legal document from a registered medical practitioner that is a doctor to a pharmacist and patient with a set of instructions regarding dispensing and intake of medications respectively. So what is the definition of prescription? It is a medico-legal written document from a registered medical practitioner, that is a doctor, to a pharmacist and patient with a set of instructions regarding dispensing and intake of medications respectively. So they are instructions by a doctor to pharmacist regarding how to dispense the medications, how to give the medications, and there are instructions to the patient regarding how to take those medications along with some other advice. Now prescription is a medico-legal document. Even if it is written on some prescription that it is not a medico-legal document, it still remains a medico-legal document. A doctor can be sued in court of law if he has made a mistake in writing a prescription or if his prescription is illegible. So a prescription should be complete, legible, and rational. What should be complete, legible, and rational? What is meant by a complete prescription? We will discuss certain parts of prescription, and all the parts of the prescription should be mentioned in the prescription while writing it. Now what is meant by legible? That the prescription should be easy to read and understand, and the person must be able to understand it correctly. Read and understand it correctly. It should not be written in an ambiguous handwriting. It should be clearly written. Now what is meant by a rational prescription? That there should be no teratogenic drugs that are given. There are no contraindicated drugs they are given. Unnecessary drugs should not be prescribed. Unnecessarily or disadvantageous fixed dose combinations should not be prescribed. Only the necessary drugs should be given. So there are 5 rights of a rational prescription. Right drug for a right patient, right indication, right quantity at right time. So these 5 rights should be followed while writing a rational prescription. I will give you some example of irrational prescriptions. For example, a patient is pregnant. So the patient should not be prescribed teratogenic drugs at this time. But the patient is pregnant and has come for hypertension, and some doctors prescribe ACE inhibitor or ARB. So that is an irrational prescription, as ACE inhibitors and angiotensin receptor blockers are teratogenic. For pregnancy with hypertension, labetalol should have been prescribed. A similar example could be a diabetic patient with hypertension. For diabetes with hypertension, thiazide diuretics should not be prescribed as antihypertensive as they cause hyperglycemia. But this patient was prescribed a thiazide diuretic. An example of unnecessary prescription would be writing vitamin D or proton pump inhibitors for all the patients that visit your OPD. So that is irrational. Proton pump inhibitor should be prescribed if the patient has a history of heartburn or hyperacidity. Similarly, vitamin D should be prescribed to patients who have either clinical symptoms of vitamin D deficiency or laboratory proven vitamin D deficiency. So, we should follow 5 rights of rational prescribing while prescribing a drug. Now, what are the parts of a prescription? So, the first part of a prescription is, first we will enumerate the parts. So, the first is doctor details. Then comes the date. Then patient details. Then diagnosis. Then comes superscription, which is the RX. Then comes inscription, which is the drug details. Then comes subscription, which are instruction to the pharmacist. Then comes transcription or signa, which are instruction to the patient. And the last is signature of the doctor, with seal. So these last 5 parts can be remembered by a mnemonic: sisters. This S is for superscription, I for inscription, S for subscription, T for transcription, and another S for signature of the doctor. So sisters. S for superscription, I for inscription, next S for subscription, T for transcription, and the last S for signature of the doctor. So now we will discuss the parts of prescription in detail. So the first part is doctor's detail. In that, the first one is name of doctor, then degree, then address of hospital or clinic, telephone number, mobile number, and registration number of the doctor. Why are these details important? The doctor details are important so that the doctor can be traced in case of a medico-legal occurrence. Suppose a doctor is sued in the court of law, doctor can be traced by all these doctor details. Now, why is degree of the doctor important? Because suppose I don't want to show to a Ayurvedic doctor, I want to show to a MBBS doctor only. Then when the degree of the doctor is written, I know that I have shown the doctor with appropriate qualification to treat the medical condition. Now, address of the hospital and mobile number of the doctors are needed so that they can be contacted in case of emergency or in case the patient has any doubt. Registration number of a doctor is important so that we know that the doctor has appropriate qualifications to practice in that area. Also, registration number is unique for a doctor. Name of two doctors can be same, but registration number will always be unique for a doctor. After this, the next is date. So date of the prescription is important, as from the date the patient can count that after how many days he has to follow up. Also, when doctor sees the previous prescription in next visit, if he sees the date, he has the idea that how many days before that patient had shown him. After date comes the patient details. In patient details, there is name of patient, age, gender of the patient, registration number of patient, weight, height of patient, and address and mobile number of patient. So name of the patient is important so that it acts as a unique identifier for the patient. Also, we can establish a good rapport with the patient if we mention him with his or her name. Now, age and gender are important because certain diseases are more common in a particular age group. For example, nephrotic syndrome is common in children. Rotavirus infection is common in infants. Then breast cancer is almost exclusively a disease of females. Hypertension occurs more commonly in middle-aged men. So that way. Now, registration number acts as a second unique identifier. Suppose name of two patients attending your OPD is same, but registration number would be unique. So it prevents mix-up of medications. If two patients have same name, we can refer them by their registration number. It is especially important in case of hospitalized patients for blood transfusion, where if name of two patients are same, at least we can differentiate them by registration number, and giving of wrong blood can be avoided. Weight and height are especially important in case of pediatric patients. Constant monitoring of weight and height can give us idea regarding nutrition status of the patient. Also, certain drugs have to be given according to weight. So their weight is important. Weight is particularly important in pediatric patients where drug has to be given according to the weight of the patient. Address and mobile number are important for traceability of the patient, which is very important in case of communicable diseases. Also, certain diseases are more common in a particular area. So we can get idea about that by the address of the patient. After that comes the diagnosis. So diagnosis of the disease have to be written. Name of the disease has to be written in full and short form should not be used. After that comes RX, which is the superscription. In RX, the R stands for recipient, which means in Latin take though, or you take. While X was actually J, it was RJ, and J stands for Jupiter, who is the Greek god of healing, who is summoned at the time of writing a prescription. After superscription, the next part is inscription, where we have 6 main details: the dosage form, drug name. The drug name has to be written in capital letters